Vaginal discharge can come in many colors, and the different colors mean different things. In the previous video, I had already talked about the clear, the cream and white, and the red or pink and dark brown colors of vaginal discharge. So make sure you see that previous video. The next color I'd like to talk about is yellow and green. Sometimes it appears greenish like this, and sometimes it's golden yellow. So this is not normal. Especially when it's accompanied by unpleasant smell. Anytime I come across this kind of discharge, the first thing that comes to my head is STI. And the particular STI that characteristically gives a yellow-green vaginal discharge, which is usually frothy with a foul smell, is known as trichomoniasis. You see this guy here? This is the bad guy. This is Trichomonas vaginalis, and this is the parasite that causes trichomoniasis. This infection is usually contracted by having unprotected sex with somebody who is infected with Trichomonas vaginalis. Let me know in the comment section if you've ever heard of Trichomonas vaginalis. You know, I worked in STI clinic for a long time, and I found that most of my patients had never heard of T. vaginalis. They knew more about the other common STIs like gonorrhea, genital herpes, syphilis, births. Many had never heard of T. vaginalis, which is really interesting because Trichomonas vaginalis is the most common curable STI in the world. Approximately 220 million cases of Trichomonas vaginalis had occurred as of January 2020, and that is according to the WHO. Did you hear that figure? 220 million. That is more than the population of some countries. And the thing that is quite worrying about this is that a lot of women don't even know they have the infection. Only about 30% of those infected show symptoms. That means that about 70% of infected women do not have any symptoms. And of course, if you don't have symptoms, you may not realize that you are sick, and you may even go ahead spreading infection to other people without even knowing it. And for those who have symptoms, it typically presents with this foul-smelling, greenish or yellowish vaginal discharge with a fishy odor. It has a kind of smell of rotten fish, and there may be associated itching, burning, soreness and pain while passing urine, pain during sex, bleeding after sex. If you have any of these symptoms, you need to get yourself checked out in an STI clinic or a sexual health clinic or whatever is obtainable in your country. Don't manage this at home. The good news is that T. vaginalis is treatable and completely curable. The treatment is with antibiotics, which the woman and her sexual partner or sexual partners will have to take. It's important that the woman's sexual partners are treated as well, even if they do not have any symptoms. Remember, we said that you can have this disease and spread it to other people without even knowing that you're spreading it if you don't have symptoms. Also, you need to avoid sex for 7 to 10 days after taking the medication. Another STI that can give you a yellow discharge is gonorrhea. And this is the bad guy that causes gonorrhea. His name is Neisseria gonorrhea, and it could show no symptoms, so you may not even know you have it. About 50% of women who have gonorrhea show no symptoms, and this means that the infection can go untreated for a long time, and these persons can go on spreading the disease to other people without even knowing that they have the disease. In women with symptoms, it commonly presents with yellowish vaginal discharge, abdominal pain or pelvic pain, burning or stinging, especially when passing urine, intermenstrual bleeding, and it also causes pain during sex. The next color is gray. Gray vaginal discharge is not normal, and this is characteristic of a bacterial infection known as bacterial vaginosis. BV for short. BV is not considered a sexually transmitted infection, but we know that the condition often occurs in women who are sexually active. And the chances of getting it goes up with the number of sexual partners a woman has. BV occurs mainly as a result of the imbalance between the good and the harmful bacteria in the vagina. Remember, we talked about this. Please see my video on how to wash the vagina and vulva, where I explain this in detail. So activities like douching, washing inside the vagina with certain soaps, use of certain products, not using condom, or having multiple sexual partners can upset the normal balance of the vaginal bacteria and cause an overgrowth of a certain kind of bacteria, which then gives rise to this grayish discharge. Again, many women with BV do not have symptoms, and when symptoms occur, it commonly comes with this characteristic gray vaginal discharge with strong fishy smell. Some women notice that the smell gets more intense after sexual intercourse or after they have had a shower. And there could be pain, itching, or burning around and outside the vagina, especially when urinating. If you have this kind of condition, please see your doctor, because BV is completely treatable and we treat it with antibiotics. How can I avoid abnormal vaginal discharge? To reduce your risk of having abnormal vaginal discharge, you need to practice good personal hygiene. And what do I mean by that? That means you need to wash your vulva daily. Again, I have explained how to do this in my previous video on how to wash your vagina and vulva. So make sure you see that. Avoid douching or washing inside the vagina. Your vagina has a natural balance of bacteria to keep you healthy. Douching removes some of these helpful bacteria and can increase your risk of having STI as well as bacterial vaginosis and yeast infection. The next tip is to practice safe sex. Some women confuse safe sex with birth control. So they think they are practicing safe sex by using contraception or taking pills. No, that is not safe sex. These are going to prevent you from getting pregnant, quite all right, but that's not what I'm talking about. I'm talking about protecting yourself from getting an STI. And the only thing that can do that for you is to use a condom while having sex. So it's either you use a condom, or you avoid having sex completely, or you limit your sexual partner to only one faithful partner who has tested negative to STIs. That way you're safe. The next tip to prevent abnormal vaginal discharge is to wear 100% cotton underwear. You see, synthetic underwears are more associated with sweating and moisture down below. That can encourage the growth of certain bacteria and yeast and can lead to thrush or yeast infection. And that is why we recommend wearing cotton underwear all the time. When do you need to see your doctor? If your vagina is sick, you need to take it to the doctor. If you experience greenish or yellowish discharge, or you have this thick, cheesy vaginal discharge which you have treated with over-the-counter medication and have not gotten relief, or there's a significant odor associated with your vaginal discharge. If you have significant symptoms like burning, itching, pain, severe irritation, pain during intercourse, burning during urination, please see your doctor. These symptoms are not normal and you need to go get yourself checked. If you're bleeding in between your period, or you're having blood-tinged vaginal discharge or spotting, or bleeding that is not related to your period, if you have a blood-stained discharge during pregnancy or after menopause, or if you have a discharge that is associated with a fever or feeling unwell or crampy lower abdominal pains, then you really need to go see your doctor and get yourself properly assessed and managed promptly. If you're having abnormal vaginal discharge, your body is simply trying to tell you that something is wrong and you need to get help. And there should be no shame about it. You see, most doctors out there have seen it all. There is nothing we doctors haven't seen or heard. So there is no way you could possibly embarrass a doctor. Trust me. So don't ever get too embarrassed to take your personal issues or private issues to a doctor. Take it to a doctor and you'll be sure to get good help. If you found this video useful, please like, subscribe, and share it. And of course, comment below and I'll be happy to answer any questions you may have. And always remember, your health matters. Bye.